coming. He's very well.
Okay.
This guy. Oh, this guy's name, he is... Hello. Oh, gosh, you really don't seem very well.
Hello, my name's Frida. I'm one of the doctors. Francis. Hello, Francis.
Oh, dear. That's all right. He's for Francis, yeah. Thank you. Sorry, I didn't mean to give you a fright.
Tell me what are you not... Can we get 15 litres of oxygen?
Do we do some sats as well?
Yeah, please.
I'll do some sats. And we'll get some
breathing.
Francis, I'm putting this on your finger.
Is speaking. So the airway's maintained, but we need some oxygen.
Some oxygen, yeah, I'll grab some oxygen. Definitely looks a bit breathless, doesn't he?
Yeah, he definitely does.
Just 15 minutes to breathe.
Yeah, please.
Yeah.
What happened before? Can you tell me, Francis, what happened to you?
I don't know.
Do you know what you're in the hospital with?
Sorry, Doc. Let me just get this on. Oh,
There was
sorry.
some bleeding happening on inside.
There you go, my love. This Doc wants this on, okay? Might help with your breathing.
Okay.
We're just having some blood.
Okay. How many units has he had?
I've just put that one up, just that one up. We've just put
So this is the only one. Okay.
Yeah.
All right.
What did you want this off, you said?
No, can we get a blood pressure, please?
Blood pressure, of course, yeah.
When did this unit go off?
Like, half an hour, maybe?
Half an hour ago. Okay, has he had obs in the meantime? No.
Yeah. They've all been... We did the ones like before, and then as he's done it, they've been fine. This has just started.
Keep that oxygen on for me just now.
It's all right. Let me just put this on your arm. There we go. Just put on that blood pressure. Okay.
I thought I was meant to be feeling better.
Okay. Okay, I'm a bit worried that he is...
That blood pressure's just going to come on your arm a bit tight, all right? Yeah?
I'm a bit worried that he's had a reaction to this blood.
Oh, really?
Possibly. Is that itchy around here as well?
His blood pressure's a bit low as well.
Okay, can we get a fluid bolus, please? And can we...
Fluid bonus, like
Yes,
500 mils?
I'm just going to do a very quick ATE. Can I have a little listen to your chest?
So do you want me to...
This is the worst I've felt ever.
Has he got a cannula in?
Yeah, he does have a cannula.
So do you want another one for the
allergies
fluid?
or something? Yes, that would be great, thank you. We should disconnect this, I think.
Oh, okay. Shall I turn it off? Okay, I'll just do that.
Yeah.
And then I can just run it through
This
that
has
one.
been stopped, isn't it? I hope.
I haven't stopped it, no.
Oh,
Do you want me to?
Yeah, please.
Okay.
Sorry.
Yeah, no, that's fine. Let me just stop that. Oh, there we go. There we go.
Okay, all right, we need a new cannula.
A new cannula?
Yeah.
Did we put one in? Yeah, definitely.
Francis, can you speak to me? Yeah, okay, so he's maintaining his airway. Does he have any allergies or anything?
No, he's not got allergies.
Feel his hand. Okay. Does it tell me any examples?
This is a 65-year-old gentleman with black loose stools, passion of upper GIV. He's got mild epigastric tenderness. The plan was for an OGD and to get 3 units transfusion today.
Okay. Right, fine.
He's got a HB drop of 68
Okay.
from 84.
Do you want me to check that blood's the right blood?
Yeah?
Yeah.
Do you want... I think it should be on there, the prescription, so... Let me have a look. I'll bring this over.
Yeah, of course.
He's not got it.
Yeah. What do you want me to do with this then? So I know they normally check it. I think on the...
We need to send it
you got
back
it?
for
Oh,
the
it's
thing. I'm
back
going
to
to keep
the
bringing
left.
80.
Have you gone there for a sec?
This one,
Yeah,
yeah.
let's go down.
Okay.
That's the blood. So is that... Do you want me to read the unit number?
Any pain in here at the moment?
Yeah, have they got it here?
It's yeah, I've got it on here. Is it the right one? So I've got
This is, okay, yeah, you know.
so it's 1, 2, 3, 4, 5, 6.
That's correct, yeah.
Yeah.
Got any
Just
more
check.
information on that?
Just check it's Francis Richard.
Do you still have pain in your tummy though?
Yeah, that's correct.
Yeah, the second.
Okay.
of
And when did you start
1959.
feeling unwell? When the infusion went through?
I think so.
Yeah. Okay.
Straight away?
Yeah, a little bit.
And how are you feeling yourself? Can you lean forward a little bit?
It's the same thing, isn't it? We've given the same right details.
We got the NHS
So
number.
what did you want me to do with it?
He's got a number on it.
That's his hospital number. Do you want me to read that out? Okay,
Yeah.
so 400 600
Yeah.
2000.
Yeah, that's correct.
Okay.
We need to send this back
It's
to
all right.
that.
It's all right. Yeah. So it's all right. Right blood? Okay, good.
Okay, can we get a cannula and fluid bolus? And I think we need some adrenaline.
Okay, I'll leave adrenaline. Oh gosh,
Yeah.
wow, okay. Alright, so I'll put a cannula. Do you take bloods? What bloods?
I think let's get a cannula on him first.
Cannula first, okay.
Give him this fluid bolus and give him the adrenaline.
Bloods, okay.
Would you agree?
Okay, let me just pop this in you.
What's the chest sounding like?
I don't know. Does it not say exam panic on here?
Okay.
Hi, Liv, sorry to bother you.
Yeah, no worries.
Frank Richards, Blood's
Francis.
been
Yeah.
Stress,
ages ago, there's no results back yet.
Sorry. This guy is, he's really quite unwell. Would we be able to get some more help in here? Would you be able to do that cannula? Is that fine?
Yeah.
I'll see if
And
I
can we
can
get some adrenaline, please?
adrenaline.
Yeah, please. Can someone bring your...
Maybe someone emergency trolley there.
Yeah, the trolley's here.
Sorry, it's just I need to find out what's happening.
So he has, his bloods haven't gone.
Is it his
No,
blood?
it's my patient, Frank Richards,
Oh, okay.
B2.
Are we
He
able
said he'd
to-
do his blood for me.
Are we able to get to that in a bit? We'll come by just a bit.
Okay, sorry,
Because
it's
not very
just
well,
my
isn't it?
patient's blood's on back. I don't know what's happening to them. All right.
We'll check on them.
We'll have to do that later, sorry.
Hang on, so his bloods. Sorry, Francis. I'm just gonna put this on. Hang on. I took his.
What will you help me?
His.
Does he have any allergies to anything in the
No.
house?
Okay. Bottom drawer anaphylaxis. Oh, no,
thank you.
Hang on. I took his blood. I took his bloods and put his name on. I took the other guy's bloods and put his name
Oh, we've got a mix up, do we?
on the bottle. I think maybe
For the group and save as well.
might have been yeah.
That's okay.
It might have been
get,
my fault.
let's go. We'll just get some new bloods off and then.
Okay.
I think
And then
he might be
we'll
having a
sort something
transfusion
out.
reaction.
Oh gosh.
I think we need to call the med-reg and get out of my depth.
Gosh. Okay.
I'll call Merit. That's okay.
I can
Oh, is it me? Is it my? Oh no.
Can you do the cannula, please?
You call Merit.
Okay. Yeah, I can.
Oh no. Oh no.
Yeah, you get the computer. Have you finished it, 18?
Oh no.
Can we really aid you?
Oh my god.
That's okay. You're gonna be okay. You take it easy.
Oh no.
Shall we go out for a walk?
Simulation switchboard.
Hi, could you put me through to the med-reg, please?
Medical registrar, 1 moment, please.
You gonna die?
Hi to MedReg.
Hi, my name's Frida. I'm one of the doctors on the gastro ward. I've been asked to see someone for high news. He's
Okay.
a 65-year-old gentleman. He was admitted with black glue stool. He's meant to have 3 units of blood today. I was asked to see him in the high news. He's quite breathless. He's got a low blood pressure. It's 98/62. He's tachycardic. There was nothing kind of particularly jumping out at me on the A to E. However, he was having a unit of blood at the time. It's been stopped. We've sent it back to the lab. I thought at first that he might be an anaphylaxis, but it turns out that it looks like one of the nurses might have mislabeled the bloods.
What? How does that happen?
I'm not sure. I'm just a bit worried that I think we'll need to look into it after. I'm just quite worried that he's having a transfusion reaction.
Okay. Oh, dear me. Right. Okay. The blood. has
Potentially
stopped.
to the wrong blood. The blood is stopped. We're not using the cannula, obviously. We've got a new cannula in. The blood's been sent back to the lab, but I'm just wondering what we need to do about this.
Okay. Rapid clinical assessment. Okay. So
Uh-huh.
a good airway respond as you find it. Has he got any life-threatening signs? So is his airway at risk?
So his airway is maintained. He's speaking, but he's very breathless.
Okay. Have you got any cardiovascular compromise?
His blood pressure is 98/62. He's quite tachycardic.
Okay.
Yeah, he is
Right.
kind of, he seems very unwell to me.
Okay. Right. What access do we have?
We have one cannula. The other one is the one that the blood went through. It needs to be
we
taken
need
out.
another cannula in.
Okay.
We'll just treat as we find. Let's keep that blood pressure up. How much of the blood has he had?
Apparently, it's been up for about half an hour.
Oh, right. Okay. All right. What I need you to do is, if you can speak to hematology,
Okay.
I'll inform ICU. I'm on my way. There's a real danger. This guy's going to go downhill fast.
Yeah, I'm quite worried about him. Okay, so I speak to haematology.
Yeah.
Would you be able to come and review
Yeah,
him
I'm
after
I'll
you've
just give
spoken to
ICU a
CC? Thanks
quick
so
ring.
much.
I'll be down. We
Thank you.
need to throw everything at this guy. All
Yeah,
right.
I think so
Okay,
too.
cheers,
Okay, thank you very much.
We'll look into what
I've only been a nurse for like 2 months.
Okay, let's worry about that after, okay? And would you maybe go for a break, okay?
Okay.
And would you be able to send somebody else in to help us? We need to make sure that that goes to the lab. Can you send that through to the lab? Keep doing the A to E, keep an eye on him. The med reg is going to come and review him after he's spoken to ITU. We need to make sure that goes to the lab.
Okay.
We need to keep a really close eye on him.
What have we done so far? Have we put another candle in?
We need another cannula, yeah. We need another cannula and
put
probably a
another
fluid bolus given his. We need to take that one out.
Can we give him some?
I'm going to speak to haematology, okay?
Okay. I'll put a
So
cannula.
can you keep A to E and do another cannula and just treat as you find, okay?
Yeah.
Hello, Simulation Switchboard.
Hello, would you be able to put me through to haematology, please?
Yeah, I just put another call through, so it might be a second. Let me just try 1 second.
Sorry? I've gone there, so my eyes are right, what's going on? She can't talk. Yeah.
Hello?
What do you need? Yeah, I can pack up something.
Hi, it's the Hematology Reg.
Hello, hi. My name's Frida. I'm one of the doctors on the gastro ward. There's a patient. He's a 65-year-old man. I've been asked to speak to you by the medical registrar because we think that he's having a transfusion reaction potentially to the wrong blood.
Okay.
His name's Francis Richardson. He's 65. He came in with GI bleed. He's meant to have 3 units today. After about half an hour after receiving the first unit of blood, he started to go very unwell. He felt very unwell. He's been breathless. He's hemodynamically unstable. Turns out that one of the nurses appears to have mislabeled the group and save that was sent down.
Oh, okay.
So I'm just the medical registrar speaking to ITU. One of my fellow doctors is kind of reviewing him constantly just to make sure that he doesn't go downhill, but we're just wondering what
Okay.
further management.
You've informed ITU.
Yeah.
Thank you for doing that. Have you stopped the blood, did you say?
The blood's been stopped. We've sent it to the lab. We're taking out the cannula that was given through and doing another one. So now he will have 2 in a second.
Okay, that's really good job. I'm going to inform my consultant, and if you're all right to inform the lab themselves, you ring them and tell them what's happened because they'll need to investigate that. There's a request that we need to fill in for suspension of transfusion reactions. I'm sure one of the members of staff on the ward can show you how to do that. And then there's a few things we need to send just to check. So if you're ready, I can tell you what we need.
Let me get a pen and something to write that down on. Yep.
So we're going to need new blood. We're going to need a purple. We're going to need 2 yellows. We're going to need another blue. You're going to need to send a urine sample, a set of blood cultures.
Mm-hmm.
You're going to need to repeat that group and save. Okay. And then you must keep the blood, the given set, and any units that he's had, and they must all go back to the lab together. Okay. If that
Keep the blood.
the giving set.
And what else? The giving set.
That delivers the blood,
Okay.
That all needs to go, and any other units he's had at any time in the admission, they all.
This seems to be the first one.
Okay, good. And then get all those done for me. Ask someone to show you how to do that request for investigation of suspected transfusion reaction. And if this blood pressure and things start to drop, just really consider allergy because you can get sort of an IgA allergy reaction. Okay.
In that case, would we be giving adrenaline?
Yeah, but I'm hoping your meds you said they're on their way, didn't you?
Yes, I hope so.
Follow that. If you think it's an anaphylactic, you just follow that.
Okay, and what would indicate that?
So if he started to get airway compromise, lip swelling,
Okay.
if his blood pressure
Okay.
was responsive to fluids, but I think
Okay.
it helps there with assessment.
Yeah, fine. Thank you very much.
No,
Thanks.
Sorry, get those things sent. All right.
And I'll speak to the lab first. Okay.
That'll be brilliant. Thank you. Bye.
Thank you. Bye. Okay, so would we be able to get, I'm sorry that I didn't say this before you did the cannula, but would we be able to get some more bloods.
Okay.
A purple, 2 yellows. Purple, 2 yellows, a blue, a repeat group and save, and some blood cultures.
Purple, 2
2
yellow.
yellows.
Yep.
Repeat.
A purple, 2 yellow, a blue,
Uh-huh.
a repeat group and save,
Pig group serve
and some cultures.
and some cultures.
There needs to be also a urine sample, but obviously that can come after the bloods.
Right, okay.
And we need to keep the blood and the giving set.
Okay.
Fill in a form that someone needs to show me,
Yeah, we'll go on the system for that, yeah.
and send those down to the lab all together. But the bloods are the priority. I'll
Okay.
call the lab.
Should we give him some antihistamines?
Is Reg on the way?
The reg should be on their way. They were just
Right.
speaking to ITU. I think they said if he starts to develop signs of anaphylaxis, then treat as
He's got
anaphylaxis.
a swollen